Hello, welcome back to part 2. In the part 1, we have discussed till the importance of sports physiotherapy. In the part 2, we are going to discuss about competencies. So what do you mean by competencies? So the competencies of the efficiency of a sports physiotherapist in treating sporting populations. Yes, according to International Federation of Sports Physiotherapy, they've described 11 competencies required for a sports and exercises therapist. Here, let's have a look what are the 11 competencies. Now, as discussed by Aston in the year of 2015, he outlined the advanced competencies of a sports physiotherapist in the promotion of safe physical activity participations. An individual who is participating in a physical activity, it must be a safe, and then provision of advice and adaptation of rehabilitation and training interventions for the purpose of preventing injury, restoring optimal functions, and contributing to the enhancements of sports performance, not only at the particular age groups, all the efficiencies in athletes of all ages and abilities, while ensuring a high standard of professional and ethical practice. Now, let's have a look what are the competencies as described by the International Federation of Sports Physical Therapists. Now, let's look the competencies described as a manager of a patient or a client, the competencies described as advisor, the competencies described as a professional leader, and the competency described as an innovator. Now, let's move on to the competencies described as a manager of a patient or a client. Here, it has included 4 subtopics called injury prevention, acute intervention, rehabilitation, and performance enhancement. Now, let's move on to what is injury preventions. We as a sports physiotherapist, we assess the risk of injury associated with the participation in a specific sport or a physical activity. Sports physiotherapists are equipped with the knowledge, with the experience that they have to inform and train athletes, coaches, and other members of the MDT, which means a multidisciplinary team. Now, let's move on to acute interventions. What do you mean by acute intervention? The acute intervention is, as being a sports physiotherapist, they should have a specific skills to respond appropriately to an acute injury or illness in a various contexts, such as training or a competition. Now, rehabilitation. What do you mean by rehabilitation? As being as a sports physiotherapist, we utilize the clinical reasoning. So there are types of clinical reasoning. So we use the clinical reasoning, any one of the clinical reasoning according to the scenario. Either it could be a hypothetical deductive reasoning, 3-track reasoning, collaborative reasoning. So whatever may be the clinical reasoning. So we have the ability to utilize the clinical reasoning and therapeutic skills. Maybe you could be a manual therapist, could be a dry needling therapist, or you could be a kinetic control movement therapist. So according to the specializations, we assess and then diagnose sports related injuries. Now, let's look at the performance enhancement. A sports physiotherapist can contribute to the enhancements of the performance through evaluation of athletes' physical as well as performance related profile, can advise, can educate or intervene to optimize the performance in a specific sport within a multidisciplinary team approach. Now, the competencies described as advisor. Before we discuss that, now as we discussed the competency described as a manager of a patient or a client, we just talk about injury preventions. Now, you may go through the link and then you can read the article about risk factors and injury prevention in elite athlete. It is a fantastic study, which is a qualitative study with a semi-structured interviews. They have used 2 questions for analysis. The objective of the study was to describe the opinions of physical therapists, physicians, and trainers on risk factors and prevention of injury in elite athlete. They found that strengthening exercises, nutritional counseling, and guidance were found to be effective in injury prevention in elite athletes. Maybe you can get more detail when you go through this article. Now, let's move on to competency described as advisor. So, what do you mean by competency described as an advisor? One, as a promotion of a safe active lifestyle. Next, as an advisor, you can promotion of a fair play and anti-doping practices. What do you mean by that? So, what do you mean by promotion of a safe active lifestyle? So, being a sports physiotherapist, we are efficient in working together with other professionals in the multidisciplinary team. We are not the one who is working for the entire team. It's a multidisciplinary team which includes from the emergency specialist, orthopedicians, sports physicians, trainers, and coach, and other medical professionals. So here we have to work together with other professionals to promote safe participations in sports and physical activity for individuals of all abilities. This is about promotion of safe and active lifestyle. Now, what is the role competency and advised as an advisor? It is expected of to provide evidence-based advice regarding the optimal activity or sport a specific individual, as well as advice on the way to minimize the risk of injury, as well as to enhance the performance or to enhance the health. Here, the anti-doping practices will be discussed later by the sports physicians. Now let's move on to the competency described as a professional leader. What do you mean by professional leader? Again, the professional leader is being classified into 2: lifelong learning and professionalism and management, as described by Bully, Janagi et al. In the year of 2004. Now, what is lifelong learning? The lifelong learning is something to improve the clinical practice or clinical standards by critical or reflective and evidence-based approaches to the practice. The sports physiotherapist, they engage in a continual process of learning and teaching throughout their career and collaborate actively with the other professionals. So we have to update ourselves in a day-to-day life regarding our professions. Now, so what do you mean by professionalism and management? Sports physiotherapists are efficient in the management of time, resources, and personnel. They achieve this in a professional, legal, and ethical manner. Also, the sports physiotherapist, they promote and facilitate professional development and excellence, as been described by Gully and Janagi et al. In the year of 2004. Now, again, the competency described as an innovator. Again, it has been classified into 3: research involvement, extending practice through innovation, dissemination of best practice. Now, let's discuss about what is research involvement. Now, the sports physiotherapists are informed and will be able to evaluate our practice in relation to new information. We'll be able to identify the questions for the further study, and we invest and we involve in a research that address the questions in various levels. Now, what do you mean by extending practice through innovations? Now, we encourage and promote the application, and whatever the knowledge we acquired, we integrate and we innovate in the team where we work. That's called a multidisciplinary team, to practice, and also the process called decision making. Now, also it influences the further research and innovation directions, which means being a sports physiotherapist, we should encourage and promote the applications to whatever the knowledge that we acquired. We have to integrate of a new knowledge and the innovations. We have to practice within the multidisciplinary team, and it will be able to help in making a clinical decision. Now, let's discuss what is a dissemination of best practice. Here, we disseminate the new informations and research to other professionals in the team to set up through different media such as a team communications or a conferences or a special interest group or research collaborations, meetings, as well as published material such as sports, journals, any promotional kind of a documents, newsletters, and the internet. Now, let's move on to role of a sports physiotherapist in international and elite sports. So, as we discussed, so the competencies described by the International Federation of Sports Physical Therapists, we have discussed about 11 competencies as a manager, as an advisor. Now, so what is the role of a sports physiotherapist in international elite sports? So the sports physiotherapist is always an integral part of the sports medicine team. So it's a multidisciplinary team. So sports physiotherapist is the integral part of the sports medicine team. One, we provide physiotherapy treatment, also rehabilitating of injured athlete to prevent the injuries. We are rehabilitating to restore their normal functions. Also, we help athletes to enhance the performance. Grant et al. In the year of 2014, they describe the role of physiotherapist as we are the provider of treatment interventions related to specific injuries. Now, when you look at the athlete perspective on a sports physiotherapist, so what does the sports physiotherapist do? They have done an interview based questions in the Woods et al. In the 2012 describe that they emerge as the injury treatment, they treat injuries, they prevent injuries, they rehabilitate the injured athletes, they'll help us to increase the performance. And what should a sports physiotherapist not do? We should not break the medical confidentiality in the multidisciplinary team, and we became complacent about their position. Now, let's look at the qualities of sports physiotherapist. So what are the qualities that we should have? We have to be a professional in a multidisciplinary team. We should have a good personal qualities. We have to accessible all the time, and we should have a good communication skills. We should have a greater interest, and we should be open-minded. As a summary, a sports physiotherapist should have a high level of competency. We have to be a patient, persistent. You know when to refer to an athlete to a physicians. Understand the emotional and psychological demand of the sports. You have to be a good communicator with athletes as well as with the coaching staff. Now, the qualities that athletes do not like. What are the qualities that athletes do not like from the sports physiotherapist? If you have a bad personal qualities, if you are not unapproachable, if you are unapproachable, not being a team player. Now, the athletes were asked these questions in their response. Again,